everybody, to episode 2 of Wellness Decoded. I'm going to be your host, Alan. I'm co-founder of Optimum Health of Utah with my co-host and co-founder,
Darlene. And I am the nurse practitioner at this office, and we are super duper excited to start our second show.
Yeah, it's the first one. We got a lot of great response and a lot of people subscribed, and it was awesome. So hopefully this information will be really good for you, and we'll do even more as we kind of get going and really ramping up. So today we want to talk a little bit about our success stories with a patient that we're going to be calling John. He came into Optimum Health just a few months ago, struggling with some of the really common things that guys go through, and a lot of times they're overlooked. And so we wanted to really break it down and kind of run through a lot of that. That's where Darlene's going to kind of explain how hormone optimization really works with our patients and the success stories that we've had. So we want to just kind of get started with our patient, John, and what brought John in.
So John is, in his 40s, typical guy, starting to have lower libido, noticing that it's affecting his relationship. His energy started to decline. His muscle strength started to decline. And his feeling of overall well-being was just in the toilet. And so he wanted to come in. He wanted to see where he was at. And the first thing people talk about when they're thinking about, especially men, these issues is testosterone. It's not always testosterone, but I wanted to bring somebody who's very, very typical of this issue into the second show so that we can explain, there is definitely a lot of this going on. We wanted to help him with his relationship, build his confidence, make him feel better, his energy. So
Absolutely. Mic a little closer there. So the symptoms and things that you're talking about were pretty common, right?
Yeah, absolutely. People will kind of chalk it off as getting older, and I've actually seen this in 20-year-olds. So when you have these particular symptoms, you got to get checked because sometimes it can actually be low testosterone or DHEA.
So when patients are coming in, especially guys, like we're talking about guys right now, what's the protocol look like? What's your approach?
Mm-hmm. So first of all, we're going to have you come in for a full consultation. I need to get kind of a background of what type of surgeries you've had, what type of medications you're on. Sometimes the medications can cause issues like with erectile dysfunction, deficiencies in testosterone. We'll get an idea of how healthy you are, what type of workouts you do, what your life is kind of like, so that we can kind of put it all together to kind of build this protocol for you. And then we'll do your full lab panel. The lab panel is not just going to be testosterone. We always want to do a full functional panel because everything is connected.
Yeah, I remember, I'm a patient in a sense as well, not with Darlene, but I have a doctor that prescribes testosterone for me. And one of the things that I remember Darlene telling me is that it's not just testosterone. There's all these other factors that come into play. And I think guys don't really realize, they just think, I just want my testosterone high. Mm-hmm. Well, yeah, you can give it, and that's great, but what if there's an underlying issue? Right?
Exactly, yeah. And doing just testosterone on its own sometimes can cause issues with breast bud development for men, breast tenderness, even breast cancer. So you've got to be careful about testosterone aerosolizing or being too high and aerosolizing into estrogen.
What are some other things? I know we kind of talked a little bit, but what are some other things that you have to be careful with too much testosterone if you're not looking at the other factors and things like that? What are other symptoms that you see?
Hair loss is huge with anybody, usually greater than 950, 900, 950. Anger issues, acne, back acne, all of that stuff is huge. And really, when you start noticing these symptoms, you're probably too high. So you should get rechecked just to make sure that you're not too high.
What about the ability to have kids?
Yeah, so testosterone does deplete some of that sperm the sperm count. So if you're planning on having more children, you need to stop the testosterone, go on something like clomiphene or HCG. I mean, a lot of those things can help you with that sperm count again. Or if you're planning on having children soon, then and you're low testosterone, low sperm count, you'd probably want to go on clomiphene.
Okay. So fast forward a few months for John, and what changes did John see?
Well, night and day. His energy just came back. His energy actually came back within the first week. He was very low on his testosterone. He was probably about 280. And so normal, there's different reference ranges for different labs, but normal is usually around 350 to 950. And so he started to build back this lean muscle. His libido was thriving. He was able to do something we call a shape scale in our basement here. We have a shape scale that actually measures your lean muscle mass, your fat content, your water content, and measures you inch by inch in every area of the body. So it really is nice when people, our clients, you get this for free. You come in and get that measured, and it really did show him where he was on his growth. And he noticed also weight loss. So he started losing fat because muscle helps to, increase your metabolism, and so you can burn more fat. Obviously, muscle weighs more than fat. So that's why this shape scale is awesome, because it really does measure all of that.
Yeah.
Yeah.
You also mentioned emotionally.
Oh gosh, yeah. His feeling of well-being came back full force. Him and his wife's relationship has improved tenfold. She actually was one of my clients before he became a client, and she noticed all of her things getting better and wanted him to come in.
Yeah, and that's one thing, and we'll talk about women in another episode, but Darlene always recommends couples coming in together.
Mm-hmm.
And why do you want that?
Because I don't want one of my husbands or wives, one of them, to go higher on the libido or the muscle strength, the energy, and the feeling of well-being. Because if both of you guys go up together, then you're going to stay, in a very close relationship. But if one's over here wanting, sex and the other one's not, then it's definitely going to cause a little bit of a barrier in your relationship. So we want both you guys to want the same thing at the same time.
Yeah, and that's pretty powerful. And this wasn't just about testosterone, right?
No, not at all. So in this particular patient's labs, we noticed that his cholesterol was extremely high. And we put him on a bergamot to reduce that. And that came down amazingly. We also noticed his cortisol was high. So with low testosterone, sometimes your stressors are a little harder to deal with, especially in men. So his cortisol levels started to go up. We put him on some adaptogens to bring that down. Mushroom blend, that really did help him with bringing down the cortisol levels. But the other thing that was kind of strange with him being so low on his testosterone was he was actually elevated on his estrogen. So we needed to bring that down because he was technically considered estrogen dominant for a man. So we put him on estradiol, which brought down his estrogen very gently, and then he was able to bring up his testosterone around the same time.
Yeah, that's great. Yeah. I can attest to that. That's a great product. And that's, you see some of them down here. These are some of the supplements we have. We're going to have a gentleman joining us that works from Orthomolecular in a future episode where we're going to really dive deep into these. Because that's the great thing that I think Darlene, she comes from this, I guess maybe homeopathic, natural. If we can do it natural, great. But she finds the right blend. It's not all about all natural, all about Western or whatever. Mm-hmm. It's the right blend for you.
Right. I believe in it all. I believe in you. Like I said in the last segment, make sure that you follow up and stay very close with your primary care physician as well. We want you to have that relationship because I do Western medicine, but I'm going to lead with functional. And then you can easily, have an issue that requires full-blown Western medicine. And that is where your primary comes in. Okay.
So for somebody that's just watching this for the first time, maybe they didn't watch the first episode, can you just briefly talk about um, functional, integrative, all that, the different types, I
Okay.
guess?
Yeah. So functional medicine is basically all natural. Um, Western medicine is all prescription sent to your pharmacy, and everything is based on writing a prescription, giving yourself the ability to take care of those symptoms with prescriptions only. Where integrative takes both of them together. With the functional medicine, you're actually fixing the problem from the bottom up. So you're taking care of the actual reason you're having these issues. Whereas the prescription in the Western medicine is taking care of the actual symptom. Right. So what we're wanting to do is put those together so that we can actually take care of your symptoms, but also fix your problem at the same time. Okay? Because we want that to all go away. We don't want to have to rely on prescription medications. You want to be able to take care of the majority of your issues with natural remedies, because it is real and it is true. Don't let anybody fool you or make you think that this is voodoo medicine. It's real and true, and we have so many people to back it up. But because I believe also in hormones, I don't think anybody should ever get hormones without functional medicine. I don't think functional medicine should ever be without hormone replacement either.
Right. Yeah, absolutely. In future, we're going to be talking a little bit more about some of the other peptides that are available out there. And obviously we'll have Nick over from Orthomolecular talking a lot about this. And so we'll dive super deep into that. So now with John's story, did you talk a little bit about, I'm not sure if you did, but I just want to make sure, did you talk a little bit about nutrition
Yes.
and the importance of that? Okay.
Mm-hmm. A lot of times as we get older, the food that we ate in the past comes to haunt us. So how do we get our the cholesterol to decrease and to prevent heart disease, things like that? Well, you want to make sure that you're eating better. We'll go ahead and we'll start bringing down your cholesterol and helping with certain things, but we want to prevent that from happening again. So diet is important. Some people are intolerant to sugar. With him, his cholesterol was elevated, so we needed to talk about reducing trans fats and increasing his good fats, his omegas. More salmon, more avocado, more almonds, etc. So he changed his diet as well, and his wife was already kind of changing hers. So it was kind of nice now that they're both on the same plan.
Mm-hmm.
And they're noticing a huge difference in weight, because majority of us in this, I would probably say, because I was reading a study recently about almost 85% of us are insulin resistant. And I think that they were chalking it up to, some sort of environmental factor like the plastics, the BPAs, the air we breathe, etc. So we do have to figure out how to combat that. And that's why we see so many people on low carb, keto, even the carnivore diet.
Mm-hmm. Yeah, absolutely. So, with other men that are out there that could possibly be listening, or a spouse or a partner that sees this and shares it with them,
Mm-hmm.
We're with John, and if they're similar, how do they get started? What type of direction can you give them to start seeking out help?
Honestly, if you're here, give us a call, get onto our website, optimumhealthmed.com, and book an appointment so you can come in for your free consultation. And then let's get your blood drawn. Let's see where you are. Let's go over those labs a few days after, about 2 to 3 days after the labs have been drawn. It should be back, and we will go over that, and then we'll get you up that protocol specific for you, because this isn't cookie cutter. This is literally, everybody has a different protocol.
Yeah, and that's the great thing. I like that she does that. so that it's really specialized to you. So, if you're feeling like any of this resonates with you, then definitely give us a call or check us out on our website. That's optimumhealthmed.com, or you can just give us a quick call, or you can even text in. And that's 801-756-1404. We'll put all of that down in the body of the podcast and in the notes, and so you can take a look at that. And we'll apply and put anything as far as some of the protocols or the articles that we can add those to. I think it'd be it's definitely worth coming in and talking with Darlene.
Yeah. Every time we have one of our podcasts, we're gonna highlight one of our patients, and whether they are in here and we actually talk to them personally, or we just bring that person's information to our podcast without giving you any HIPAA or information related to them specifically. What we wanted to do was kind of give you these real people
real
stories so that you guys can relate and you can say, hey, I'm one of those. Oh my gosh, I didn't realize that at 30 I can have low testosterone. Oh yeah, at 30 you can have low testosterone. You can have low testosterone at 20.
Right.
Recently, and this is what I might want to talk about next week, is an 18-year-old with extremely low testosterone, and he had a condition that was causing this.
Yeah. So perfect.
Right.
Well, that's episode 2 for us. We're going to leave you here with that. And please, if you like it, give us a thumbs up, and you feel so inclined, please subscribe. We're going to have some really great content, guests that are actual real patients that have decided, because they love what Darlene has done so much, they're willing to come in and just share their story, which is awesome.
Yeah.
So,
and some of them might be doing like some recordings and stuff and sending them in and stuff.
Yeah. So.
Yes, we love our patients and we love you.
All right. We'll see you on the next one.
Bye.
Love you. Bye.
Mm-hmm.